I think in orthopedics, there are a lot of problems that have to be treated based on the needs of the patient. For example, I'm going to treat a wrist fracture in an active 20-year-old probably differently than I am a sedentary 80-year-old. And so, although those are two dramatic examples, I think that as a whole, our practice does a good job of individualizing patient care based on the patient's activity levels and the patient's functional needs.
For that individual who may get injured in football, but his primary sport is basketball, if I don't understand that as a surgeon, I'm going to potentially move them in a different direction. There's a lot of emphasis on kids getting college scholarships in their junior year. And if you don't understand that junior year is a really critical year for them, even more so in a lot of cases than their senior year, again, you may not be able to get them in a position where they're going to be able to fulfill that overall desire.
And so I think in our office there's definitely this kind of personal connection that the physicians try to make with their patients, and I think that really bodes well to how we treat them, how we view them in terms of their recovery. I think it's important that patients understand that when us docs here take care of them, think about them, they do think about them as their family members. That helps us develop more of a personal connection with them, and helps us to understand their goals better and be more empathetic towards their goals. As we have goals for our family members, it's easier to kind of understand what our patients' goals would be as you kind of think about it in those terms.